Hello everyone, my name is Xiaoqing Wang. This is my term paper presentation. The title of my presentation is The Effects of the Pender's Health Promotion Model in Improving Hepatitis B Screening Among Chinese Americans. So the issue and problems. About 1.25 million people in the US currently are affected by this hepatitis B virus. According to CDC, the newly reported hepatitis cases was more than almost 3,000, and estimated actual number is much more than that. The hepatitis B virus also disproportionately affecting Asian Americans, particularly Chinese American, as the chart shows. But good news is, fortunately, early detection, screening, and proper treatment currently available, and moreover, early screening and vaccination has already been documented as cost-effective to prevent many public health issues, including this hepatitis B virus infection. So for the background and significance, my study impetus is hepatitis infection degrade the hepatitis B sufferers quality of life, limited hepatitis B patient employment opportunity back in China. As I know, Chinese American with a liver cancer resulting from the hepatitis B infection are 6 times more prevalent in numbers compared to their Caucasian counterparts. The majority of the new immigrants from China infected as newborns, which makes them more prone to develop a chronic hepatitis B infection and leading to the liver cancer. More Chinese American at high risk currently lack the understanding of the hepatitis B related diseases and the corresponding consequences. So this is the prevalence and the incidence. As you can see, Chinese American ranking very high among those risk groups. And the my research question is Pender's health promotion model based on electronic health record prompt hepatitis B screening protocol or algorithm applying in a primary care setting, improving hepatitis B screening rate among Chinese American. So this is my review of literature. Current barriers, we have 3: patient-related factors, provider-related factors, U.S. healthcare system-related factors. So first is patient-related factors. I reviewed several articles, and the conclusion is patient-related barriers can be well resolved when primary care provider, PCPs, provide a proper education and recommendation for hepatitis B virus screening for Chinese Americans. For the second is provider-related factors. The several articles has been reviewed. The conclusion concludes to inform the PCP and the hepatitis B screening tests are cost-effective and the hepatitis B treatment and insurance coverage are available. It's important to improve hepatitis B screening rate. So for the U.S. healthcare system related factors, the conclusion said as to the aforementioned challenges, culturally friendly, community-based clinics in which culturally competent PCPs are present need to be created and could help Chinese American better access the U.S. healthcare system and their seek hepatitis B screening. So the existing solution to low hepatitis B screening. So 4 relevant and current study reviewed in this PowerPoint. So the first study is a random control study was done to assess the effectiveness of embedding hepatitis B education curriculum into an existing ESL program for the new Asian immigrants. The results is very promising. 6% of experimental group participants received hepatitis B screening tests after ESL, of course, with this intervention, and compared to those without the intervention. So the results shows statistically significant. So the second study is also a random control study, was conducted by recruiting 175 PCP participants to take care of the Chinese and Vietnamese American patients who reported not having hepatitis B screening test before. The results still shows the promising. The experimental group with the EHR prompts reported a hair hepatitis surface antigen test ordering rate and compared to those control groups. So the P here is less than 0.001. In the third study, a 5-year random control study was conducted with the collaboration with both researchers and the Hmong group leaders, which is among those high hepatitis B infection group. So the results also shows the higher hepatitis B screening rates compared to the control group. And the first study is a description study. So the author says the low hepatitis B screening rate among Asian Americans could be attributed to the inefficiency of the public health primary care system in addressing the hepatitis B infection. The Affordable Care Act can potentially increase the hepatitis B screening rate by providing all kinds of resources, as you can see I listed here. There are some changes, but similar programs still can do the same thing. So I cited 2 studies using the health promotion model-based health approaches. So the first study, the author conducted a study to investigate the effect of the Pender's health promotion model to improve the nutritional behavior of the overweight and obese women admitted to these hospital clinics in Iran in 2015. This is called a experimental study, and the conclusion says the result shows that Pender's health promotion model-based training program improved the nutritional behavior and some construct of the model. Therefore, this educational model can be used by health providers to improve the nutritional and other health-promoting behavior, including my hepatitis B screening. So the second study, the author carried out a study to determine the effectiveness of the nutritional education intervention based on the Pender's health promotion model, improving the frequency and the nutrient intake of the breakfast consumption among female Iranian students. This is also a quasi-experimental study, and the conclusion still, the result shows statistically significant results in the intervention group, and the conclusion is construct of the Pender's health promotion model provide a suitable source for designing strategies and content of the nutritional education intervention for improving the frequency and the nutrient intake of breakfast consumption among female students. So summary of the review my review of literature. The Chinese American as an ethnic group sustain various characteristics, including the culture, language proficiency, health beliefs, newborn care, among others, which put them at high risk of hepatitis B infection and its complications. PCPs can play a more active and critical role in increasing Chinese Americans' hepatitis B screening rate. More provider effort is required to help Chinese Americans effectively access the U.S. healthcare system and other available resources. Based on the 2 study using hepatitis B, using the health promotion model-based intervention, it is a suitable strategy to use the Pender's health promotion model-based intervention tools to improve the hepatitis B screening rate among Chinese Americans. So, the gaps in the literature review, more current research is needed on the barrier to on the barriers and the benefit of the action to screening for the hepatitis B virus. Research that is specific to Chinese Americans as well as all of their subgroups needs to be conducted. Researchers need to examine how to make the available resources in the current U.S. health system to support this event. Intervention studies using the EHRP and other effective solutions must be done to determine the most effective approaches to increase the hepatitis B screening rate among Chinese Americans. So this is the protocol and algorithm I created based on the health promotion model of Pender's. Based on the analysis of the existing barriers and proposed solutions, intend to improve the hepatitis B screening rate among Chinese American, specifically, and it can be used in any primary care setting in which hepatitis screening is needed in general. So either use the computer-based program or as a handy paper protocol. So this is the paper 1. So if you want to know details, you can refer to it. And a little about the Pender's health promotion model. This model is designed to examine the dynamics among the psychological, biological, and sociological aspects that affect the individual's health behaviors, choice. There's 3 components: individual characteristics and experience, behavior-specific cognition and affect, and interpersonal and situational aspects. The validity and the reliance of this model has been widely validated through its broad application in nursing and healthcare research. So this is the Pender's health promotion model. So as you can, there's an individual characteristic and also behavior specific, cognition, affect, and behavior outcome. So I apply this model into the patient and as well as the provider. So in the patient, as you can see, in the prayer-related behaviors, you can see history of the blood transfusion before, or unprotected sex, or maternal history of hepatitis B virus infection, or multiple personal factor like multiple sex partner or shared needle during the IV drug use, or men sex with men, or live with someone with hepatitis B virus infection. All this, go through the perceived benefits, perceived barrier, perceived self-efficacy, and at the end, it goes to health promotion behavior, hepatitis B, screening seeking, and or receive the vaccination, or even receiving the monitoring and the treatment. For the provider, the same. So history of screening the Chinese American for hepatitis B before, or previous experience with the hepatitis B patient, or rate of the providing hepatitis B related education or counseling, personal factor or previous training or knowledge about the hepatitis B screening. All this need to the community to a plan of action, like a regularized high risk group or patient for hepatitis B, like Chinese American immigrants, provide hepatitis B screening, vaccination, and monitoring and treatment. So this is some recommendation for the practice and future research. Study among Chinese American and their ethnic subgroups, including gender-based studies, need to be conducted. EHRP and based HPV screening algorithm protocol intervention need to be validated. A system or program able reach more Chinese American and leading them into assessing primary care services needed. More research needs to be performed on or conducted on social cultural factors, ethical issues, financial difficulties, and family dynamics. So this is my conclusion and some implication drawn from previous slide. Chinese Americans are facing hepatitis B screening disparity challenge, patient-related barriers, healthcare provider-related barriers, and U.S. healthcare system-related barriers still existing. A culturally sensitive hepatitis B education program is needed as well. A well-trained and culturally competent PCP community is required to complete this mission. FNP, I'm one of them, can serve as excellent PCP and advocates for Chinese American patients in increasing their hepatitis B screening rate. A supportive healthcare system is a must to provide all kinds of resources. EHRP based and also Pender's health promotion model based EHRP hepatitis B screening algorithm protocol is a practical solution based on this study and literature review. It is effective to use hepatitis B education intervention based on Pender's health promotion model, improving hepatitis B screening rate among primary care providers. Thank you. If you have any comment, please leave at the below the PowerPoint, and you can refer to the exact PowerPoint. I will post it on the our forum. If you have any question, you can put there as well. Thank you for your time. You have a very, very good day.